All right, today we're going to talk about caring for individuals with disabilities. The objectives of this training are at the end of the training session, you'll be able to show a clear understanding of company policy. You will be able to perform a med pass correctly for your individual. You'll also be able to demonstrate that you know how to use the nursing site in terms of medications. And you will learn and demonstrate proper CPR technique both on adults and infants. And then you'll also be able to demonstrate proper charting format when you finish your shift with the individual. So first off, we're going to watch a video on adult CPR. Following this video, we'll have a little activity to see and make sure that you picked up on what she was saying.
I'm going to demonstrate how to administer CPR on an adult. Okay, suppose you find someone lying down on the floor. What are you going to do? First, assess the scene. Look around. Make sure the scene is safe. Are there safety hazards? A chemical spill? Electrical wires? Gas fumes or anything dangerous? You can't help anyone if you become a victim too. If the scene is safe, check the person for a response. Tap or shake the victim on the shoulder and shout, "Are you okay?" If you do not get a response from the victim, yell for help. Next, tell a specific bystander to phone 911 or the emergency response number and get an AED. And very importantly, to come back to help. Many facilities, stores, schools, airports, conventions, and sports arenas will have AEDs available. Next, check the victim for breathing or only gasping. You need to scan the victim's body back and forth from head to abdomen for at least 5 seconds, but no more than 10 seconds. Agonal breathing sounds like gurgling or gasping. It is not breathing. You must start CPR. Now check for a pulse. To locate a carotid pulse on an adult or child, place your 2 fingers on the center of the victim's neck. Slide your fingers down the side of the neck into the notch between the muscles. You should feel a strong pulse there. If the victim has a pulse but is not breathing, give 1 rescue breath every 5 seconds. Then recheck the victim's pulse every 2 minutes. To perform a rescue breath, gently tilt the victim's forehead back with 1 hand, and with your other hand, lift the victim's chin. This position opens the airway. Pinch the nose closed and cover the victim's mouth with your mouth, breathing life-giving air into the victim. If you have a one-way mouth guard, use it as directed. The mouth guard has a one-way valve and protects the rescuer from contact with vomit, secretions, infectious fluids, etc. Place the elastic bands around the victim's ears to hold it in position. Give 2 rescue breaths, 1 second for each breath. Look for chest rise. If you don't see the chest rise, reposition if needed. If the victim has no pulse, start the CPR cycle of 30 compressions, 2 breaths, 30 compressions, 2 breaths, until help arrives or you can no longer perform effective CPR. Let me show you how to do this. First, if possible, remove clothing out of the way of the victim's chest. Next, locate your hand placement for compressions. With your hand, draw a line from armpit to center of chest for placement. Place the heel of 1 hand on the lower half of the sternum or breastbone. Now, place your other hand over the first, interlacing your fingers for support. With your arms straight and your shoulders positioned over the victim's chest, push down on the victim's chest. For an adult, you will want to push down at least 2 inches or 5 centimeters. Now watch as I perform 30 deep compressions in 18 seconds or less. You want to be able to give at least 100 compressions in a minute. You may lift your hand slightly off the chest between compressions to allow for full chest recoil. But keep your hand placement. Keep interruptions to a minimum. It helps to count out loud. Some say humming the tune to the 1980s pop tune Stayin' Alive is good for keeping